Herbs for mouth ulcers of children. Mouth ulcers are little sores that come up inside the mouth, on the tongue or on the gums. Several things can cause mouth ulcers. Viral infections like cold sores or hand, foot and mouth disease. Oral thrush. Injuries like biting, burns or rubbing from braces. Low vitamin levels. Diseases like celiac disease or inflammatory bowel disease. Sometimes ulcers keep coming back without any obvious cause. Symptoms of mouth ulcers. Mouth ulcers usually look like round, white sores on the inner lining of your child's mouth, or on the surface of her gums or tongue. These sores can be painful, especially when your child eats salty or spicy foods. Sometimes your child might even refuse food until the ulcers start to heal. If an infection is causing the ulcers, your child might also have a fever.
Herbs for mouth ulcers of children. 1. Licorice. Botanical name, Glycyrrhiza glabra. Tonic and anti-inflammatory, this most versatile of herbs finds use in treating ill health of all kinds. Added routinely to herbal prescriptions, licorice acts on the adrenal glands and seems to reinforce the action and improve the flavor of herbs with which it is combined. The medicinal value of licorice was championed by the ancient Greek commander Alexander the Great, 356 to 323 BCE. It is said his troops chewed on licorice roots before a battle to give them fighting energy, which would have been derived from its effect on their blood sugar and adrenal glands. Soldiers also used it to quench thirst while marching, and thought it helped them stop shaking with fright during battle. Known as the sweet herb, licorice contains glycyrrhizic acid, which is 50 times sweeter than sugar. Part used, root. Actions. Anti-inflammatory. Antiviral. Demulcent. Expectorant. Tonic. Best taken as tincture, capsule, dried root. Licorice's soothing, healing action works throughout the gastrointestinal tract, making it applicable in any situation where the gut or stomach wall is inflamed or ulcerated. Licorice tea taken at night can help ease acid reflux. Licorice's anti-inflammatory action serves to relieve stiffness, heat, and pain in muscles and joints. Working in a manner not too dissimilar to prescribed steroids, it helps to dampen chronic inflammation, easing associated discomfort in conditions such as rheumatoid arthritis and polymyalgia rheumatica. On its own or in combination with other herbs, licorice tea makes an effective, pleasant-tasting mouthwash or gargle for sore tongue, mouth and throat ulcers, and laryngitis. Swallowed, its demulcent action soothes irritation and inflammation within the airways, such as in bronchial infection, helping to ease cough and stimulate the clearance of phlegm. The herb also appears to protect against tooth decay. Not really an herb to use on its own in this context, licorice combines well with other immune-enhancing herbs to strengthen the body's capacity to counter viral and other infections. Among other conditions, licorice has been recommended for chronic fatigue syndrome, mononucleosis, Lyme disease, shingles, and tonsillitis. Licorice can provide valuable support in any situation where the adrenal glands have been subject to long-term stress. It makes an effective tonic in aiding recovery from illness and chronic exhaustion. An estrogenic remedy, it can be particularly helpful in menopausal exhaustion. Research in China indicates that licorice can prove helpful in polycystic ovary syndrome, improving menstrual regularity and fertility. It also supports liver function and soothes mucous membranes in the stomach and airways. Licorice makes a valuable tonic to aid recovery from illness and the return to good health. Dosage for adult, 2 to 4 grams a day, or 30 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 rod the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: do not take large doses if you have high blood pressure. During pregnancy or for long-term use, consult an herbal or medical practitioner before using. 2. Echinacea. Botanical name: Echinacea angustifolia, Echinacea purpurea, Echinacea pallida. A plant from the plains of North America, Echinacea is thought to powerfully stimulate the body's ability to resist infection and counter toxicity. Taken mainly as a treatment or a preventative for common cold, flu, and viral infections, the herb also helps heal skin disorders such as eczema and acne. 3 Echinacea species are used medicinally. All are threatened in the wild, but Echinacea purpurea is cultivated widely in the US and Europe. Parts used: whole plant. Actions: antibacterial, antiviral, blood cleanser, immune enhancing, wound healer. Best taken as tincture, tablet, capsule. Echinacea, as tincture, tablet, or capsule, is frequently taken to speed recovery from colds, sore throats, and chest infections. The herb is also known to enhance immune resistance in those prone to recurrent colds or herpes outbreaks or where flu-like symptoms linger. Echinacea combines well with the flower or berry of elder, Sambucus nigra, in this context. The diluted tincture makes a mouthwash or gargle, and can be used to wash infected skin rashes and wounds. Bacterial infections, such as sinusitis, tonsillitis, and chronic bronchitis can be self-treated with Echinacea, preferably in combination with remedies such as garlic, Allium sativum, and golden seal, Hydrastis canadensis, but a fever of 39 degrees Celsius or over indicates the need to seek professional advice. Although the evidence is reasonably good, there is still some debate on Echinacea's effectiveness in treating and preventing infection. This may be partly because the dosage used in some clinical trials was too low, or the wrong plant parts or species were studied. The quality and form of Echinacea products are important. Echinacea angustifolia or extracts of the fresh pressed juice of the above-ground parts of Echinacea purpurea are thought to have the strongest medicinal activity. Echinacea stimulates nonspecific immunity, increasing the number and activity of white blood cells. This makes it a frontline remedy wherever the immune system is overburdened by chronic infection or toxic residues, such as swollen lymph glands, recurrent boils, chronic dull headache, or sore throat. Used carefully, and this means in conjunction with an herbal practitioner, it helps in cleansing the lymph system, supporting resistance to underlying infections such as fungal problems, and improving overall vitality. Echinacea is not suitable for self-treatment in autoimmune disorders or HIV infection. Knowledge of Echinacea's medicinal value has been passed down from the experience of Native Americans. Used traditionally as a treatment for snakebite, hence its other common name, snakeroot, Echinacea has been used to prevent septic infection in wounds and as a remedy for toothache, sore throat, and rabies. Dosage for adult, 3 to 7.5 grams a day, or 50 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: can cause allergic reactions. If taking prescribed medication, seek advice from an herbal or medical practitioner.